नमस्कार शिक्षार्थियों और श्रोताओं, राष्ट्रीय मुक्त विद्यालय शिक्षा संस्थान में आप सभी का स्वागत है। शिक्षार्थियों और श्रोताओं, आज जो सीनियर सेकेंडरी लेवल के लर्नर्स के लिए हम जो कार्यक्रम लेकर आए हैं उसका सब्जेक्ट रहेगा साइकोलॉजी। टॉपिक पर आज हम बात करेंगे वो है साइकोलॉजिकल डिसऑर्डर। जी हाँ, आपका लेसन नंबर 20 है और इस टॉपिक पर अधिक जानकारी दे रही हैं मिस सारिका जी। तो आइए शिक्षार्थियों, मिलकर सुनते हैं कार्यक्रम साइकोलॉजिकल डिसऑर्डर।
Hello learners, today we are going to discuss chapter number 20, which is psychological disorders. Feeling happy or crying when one is hurt, or some common actions which we all engage in sometime or the other. Most of the time we act as the situation demands to us. That is, we control our emotions and behaviors according to the norm prevalent in the society. But if our behavior is perceived to occur without any reason or against the context, how will you evaluate that? It will not be called a normal behavior, in other words, and it will be termed as abnormal behavior. But again, at some point of the time in our life, many of us behave irrationally or away from normal behavior. So what is the definition of abnormal behavior and what are the factors which causes the abnormal behavior? Let's understand the objective behind this particular chapter. This chapter helps us to identify, explain the different types of psychological disorders. It will also enumerate and describe the major types of abnormalities. It will help in describing the symptoms of various types of psychological disorders such as anxiety disorder, somatoform disorder, mood disorder and schizophrenia. As the name itself suggests, any disorder which presents a person to function effectively in the social domain is termed as psychological disorder. The psychological disorders can be defined as a pattern of behavioral or psychological symptoms that causes significant distress. It impairs the ability to function in one or more areas of life or both. The important feature is that symptoms which a person is showing must represent a serious departure from the prevalent social and cultural norms. Cultural and social norms are being empathized here because the traditions in each culture differ. Some actions which may form an essential part of one culture may be serious disturbances in others. For example, tribal societies have different norms and cultures. Their way of living and habits will be considered abnormal in the urban context. To determine any behavior as away from the normal, 7 considerations are used as these distinguishing criteria, and that are suffering, which is experiencing distress and discomfort in one's own life; maladaptiveness, that is engaging in the behavior or thought pattern which makes it more difficult to lead one's life; irrationality, that is unable to communicate in a reasonable manner with others; unpredictability, that is acting in ways which are entirely unexpected to the society as well as the people around you; vividness and intensity, that is experiencing sensation which are far more vivid and intense than those of the other people; observing discomfort, acting in the ways which others find embarrassing, and also the violation of the moral and ideal standards, which is the habitual breaking of normal societal norms. As we have read earlier as well, normality and abnormality are not very rigid concepts. As states of mind, they lie in a continuum and most of us experience them in a different phases of life. It can be said easily that abnormality is a matter of the degree to which a set of behaviors of an individual appropriate as against accepted norms of the society and which are problematic for the person in his or her social functions and adjustment. Now, let us understand the various causes of abnormal behavior. There are many factors which contribute to the cause of abnormal behavior, and some of them are the first one, which is a biological factor. The biological factors which give rise to abnormal behavior may include the genetic factor, chromosomal dysfunction, brain or endocrine dysfunction that may cause the development of abnormal behavior. And the second one is the psychological factor that causes abnormal behavior and are difficult to identify and measures as they work indirectly. The effect is not very predictable, but if one tries to analyze the various processes adopted during childhood, like overprotection or overindulgence, inconsistent rewards and punishments, these factors significantly contribute in the development of maladaptive behavior. Now let us understand about different types of abnormal behaviors and its causes. Some of the major psychological disorders are anxiety disorder, mood disorder, schizophrenic disorder, and substance-related disorders. Anxiety disorders. All of us have experienced anxiousness or anxiety in our life in some way or the other. Whether it is during examination or waiting for an interview result, or maybe due to the death of some loved ones, anxiety is experienced by all of us. We also have our own way of coping with it, but anxiety can take the forms of a disorder if not treated properly at a correct period of time. Anxiety disorders are the disorders which decreases the performance or social functioning of an individual due to hyperanxiety, and anxiety disorder can be of many types. Some of the anxiety disorders are psychological, social disorder, panic disorder, phobias, obsession, and generalized anxiety disorder, which is a GAD, somatoform disorder, and post-traumatic disorder. Now let us understand one of them. Generalized anxiety disorder. It is the most common form of anxiety disorder. The chief symptoms of this disorder is unrealistic or excessive worry. The various symptoms of generalized anxiety disorder, which is GAD, is nervousness, dizziness, sweating, trembling, tension, difficulty in concentration, etc. If we talk about different types of mood disorders are the disorders of emotions. Heightened intensity and duration of emotions require immediate psychological and medical attention. The individuals suffering from this type of disorder are termed as emotionally disturbed or having some sort of a mood disorder. The three types of mood disorders have been characterized as depressive disorder, bipolar disorder, and other disorder. Mood disorders include severe symptoms such as dissatisfaction and anxiety, change in appetite, disturbance of sleep, and psychomotor functions. It also includes sudden weight loss, inability to think clearly, and thought of death and suicide. In some of the disorders, the genetic factors are involved. Drug therapies and biological therapies have been found to be very effective for this treatment. Substance-related disorders. Now, it has been found that when people suffer from prolonged period of pain or tension, they take drugs or alcohols. Drugs like alcohol influences our thoughts and action as well as the activities negatively. These drugs, if used for a long period of time, can cause deterioration in our attention, motivation, as well as our motor coordinations. People have suffered losses in their personal and social life due to the usage of these drugs. The substance-related disorder is not only limited to the usage of alcohol, but it also related to the different type of substances like tobacco, opium, marijuana, etc. To help a person suffering from this disorder, the following issues are very important. such as detoxification, administration of drugs for easing withdrawal symptoms, aversive conditioning, social support, psychotherapy sessions, rehabilitation, and prevention as well as follow-up. Now let's understand few more types of anxiety disorders which we were discussing. The first one is panic disorder. Intense anxiety along with the marked physiological symptoms such as increased palpitation, breathing difficulty, and a sense of helplessness or hopelessness are seen in the case of panic disorder. Before and after the release of anxiety, calmness prevails. The person suffering from this disorder may not remain always anxious. There could be some sort of a period or action or some sort of a situation that causes the person getting very anxious and then moving to panic disorder. Phobias. Phobia means an irrational fear of some object or situation. Most of us have a fear about something or the other, but when this fear reaches the level when it disrupts the normal functioning, then it is termed as phobia. One type of phobia, such as social phobia, when one is afraid of speaking on stage or talking to the strangers, and there are some other specific phobias also, such as the fear of rat or cats, etc. The next topic is obsessive compulsive disorder, which is also known as OCD. The persistent thoughts or wishes that intrude into one's consciousness and cannot be stopped are obsession. Compulsion is an act which a person feels compelled to carry out despite knowing that it is unnecessary. Obsessive thinking often leads to compulsive acts. So basically, when a person is having different type of thoughts despite trying to not to have them, and these thoughts are consistent and coming again and again, it might be possible that you have some sort of an OCD, and these type of thoughts which could be related to the present, future or past are the obsessive thoughts. When because of those thoughts you are taking some sort of an action related to those thoughts, it is compulsion. That is, the action is being taken because of the obsessive thoughts. And when both the things are going on, such as when there is a thought also and you are taking the action also, then it is known as the obsessive compulsive disorder, which is OCD. Now moving on to the next disorder, which is somatoform disorder. So the somatoform disorder refers to the physical problems which have no organic basis. For example, fatigue, headache, vague body pains, etc. The person suffering from this disease remain preoccupied with symptoms. It might be possible that you are feeling that you are getting pain in your legs, or you might be feeling pain in your hands, or you might be having chest pain. But when every sort of x-ray or everything has been done, but nothing has been found. So it might also be possible that the person is suffering from somatoform disorder, which is a false disorder, and the person in this disorder feels somatic or false pain in their body, and they feel that they are suffering from something despite they are not. Now moving on to our next disorder, which is schizophrenia. So schizophrenia is considered by the experts as the most devastating mental disorder. It can be defined as a cluster of disorders characterized by the fragmentation of the basic psychological process such as attention, perception, thoughts, emotions as well as behavior. This fragmentation leads to the serious maladjustments. Patients suffering from schizophrenia do not perceive things happening around them correctly, and they often see or hear things which are not there. Their thinking pattern is confused and disorganized, and they fail to communicate properly with others. It might also be possible that the schizophrenic patient feels delusions and hallucinations, and they might also feel that they are talking to someone despite they are with no one. So schizophrenia is one of the most devastating disorder in psychological disorders. The categorization of schizophrenia is like this. If you are suffering from catatonic schizophrenia, it includes the unusual patterns of motor activity, speech disturbances such as repetitive chatter or rigid posture. Disorganized schizophrenia is verbal asymmetry, poorly developed ideas. If the person is suffering from paranoid schizophrenia, it is preoccupied with one or more set of ideas, which is definitely not acceptable in the society. If the person is suffering from undifferentiated schizophrenia, they get hallucination and incoherence. And if there is a residual schizophrenia, the person might be having withdrawal or absence of motivation, etc. The primary symptoms of schizophrenia are disturbances of thoughts, disturbances of perceptions, disturbance in the emotional expressions, disturbances of speech, social withdrawal, and low motivation. Now let's understand different types of personality disorder. So let's take an example. Ram Mohan is basically a clerk in a company. As a clerk, he was able to do the work that was assigned to him. But whenever any situation comes when he has to take an action or a decision, he is not able to do so. He has a good rapport with his seniors because he was highly submissive. But when his promotion was due, his officers were not sure about his capability for that position. This is an acute cause of dependent personality disorder where the individual always shows a need to be taken care of and is not able to show how any decision-making skill or a decision-making he can do. Another form of personality disorder is antisocial disorder, in which the individual show irresponsible and socially disruptive behavior like destroying property, stealing, etc. The personality disorder is characterized by a maladaptive style of thinking, feeling and behaving which disturbs the normal functioning of an individual. Now, let's understand what we have discussed in the part of disorders. Any disorder which prevents a person to function effectively in a social setup is known as a psychological disorder. The behavior should show a serious departure from the prevalent social and cultural norms. To determine any behavior as abnormal, 7 considerations as used as a criteria, which are maladaptiveness, irritability, unpredictability, vividness, observer's discomfort, and the violation of moral standards. The cause of abnormal behavior can be biological as well as psychological. Some of the major psychological disorders are anxiety disorder, mood disorder, substance-related disorder, and schizophrenia. Anxiety disorder decreases the performance of a person due to anxiety. The various forms of anxiety disorders are somatoform disorder, generalized anxiety disorder GAD, panic disorder, phobias, OCD, etc. Schizophrenia is a severe psychological disorder. Schizophrenia is also characterized by the fragmentation of the basic psychological process. The various forms of schizophrenia are catatonic, disorganized, paranoid, and undifferentiated and residual. So, these were the psychological disorders that we have discussed. Now, we will understand different type of psychological therapies and treatment for these psychological disorders. So basically, psychological disorders can be treated either through the medications which are being provided by a psychiatrist or through the psychological therapy sessions which are being done by a clinical psychologist. Now, according to the medical model, the abnormality occurs due to the physical cause and is a kind of illness which can be treated with the help of medicines. This approach examines the roles of genetics and imbalances in the neurotransmitters. The therapeutic approaches used in the medical model are referred to as the somatic therapy. 3 somatic therapies which are currently used as chemotherapy, electroconvulsive therapy which is ECT, and psychosurgery. The ECT involves administering the electrical current for a short duration through the electrodes to the head of the person suffering from psychological disorder. For example, in the unilateral ECT, the two electrodes are attached to the temple region and a current of approximately 200 milliamps at 110 volts is passed from the one electrode to another for 0.5 to 4 seconds. The ECT is used to treat the depression, bipolar disorder, which is a mania depression, and also the obsessive compulsive disorder, which is OCD. The psychosurgery involves performing surgery on the brain to alter the psychological functioning. It is used only as a last resort in the extreme psychological disturbances like in aggressive schizophrenias. The most common and effective somatic approach is chemotherapy, which involves giving medicines to the person with the disorders. There are three main types of medicines: neuroleptics, major tranquilizer, and antipsychotics are mainly used to treat schizophrenia and mania. Antidepressants are used to treat several disorders including depression. Anxiolytic drugs, minor tranquilizers, are mainly used in the anxiety disorders. Psychodynamic therapy. As you already have studied and read about the Sigmund Freud's psychodynamic model, it looks at the mental disorder as caused by the internal psychological factors which are basically unresolved, unconscious childhood conflicts. Therapy in this model is referred to as psychoanalysis. The purpose of psychoanalysis is to understand the unconscious conflicts which are responsible for a person's mental disorder and then to make the person consciously aware of it. This allows the person to deal more effectively with his or her problems. The approach most widely used in the psychoanalysis is a technique called free association. The basic procedure is that the patient says whatever comes to the mind. Since this bypasses the ego's role of censoring or blocking the threatening unconscious impulses. The ultimate goal of psychoanalysis is to measure modification of the personality to enable the people to deal with the problems in a realistic way without using the defense mechanisms. Sometimes the hypnosis and dream interpretation are also used to help the therapeutic process. Now, let's understand the behavioral model. As you learnt in the earlier lesson, in the behavioral model, disorders are viewed as learned maladaptive behaviors. Watson was the first person to suggest that mental disorders such as phobia, which is an extreme fear of certain objects, people, or situations, can be explained in terms of the mechanisms of conditioning. The behavior therapies are classical conditioning principles where the behavior modification techniques are based on the operant conditioning. In behavior therapy, the assumption is that if maladaptive behavior can be acquired through classical conditioning, they can also be unlearned by the same principle. Three approaches based on the behavior therapy are implosion therapy, flooding, and systematic desensitization. Implosion therapy and flooding are based on the concept that if stimulus causing a fear response, example, let's take a snake, is repeatedly presented without the unpleasant experiences that accompanies it, it loses its power to evoke a fear response. In implosion therapy, the therapist again and again exposes the person to the mental images of the fear stimulus in the safety of his room. The person is then asked to imagine the most frightening form of contact with the fear object. After a number of trials, the stimulus loses its power to cause any sort of anxiety. So, let's take an example, a very simple example, that someone is fear of rats. So the therapists are going to make an image of rats in such a way to the person's mind that the fear consistently goes down. And after a certain period of time, when the person have been exposed to the image of rat and the rat characteristics so many times, the the fear related to that particular rat has been completely decreased and has been down. Now, in systematic desensitization, the person is also asked to construct a series of scenes or events which gradually lead the person to face the object situation which causes the fear. For example, a person who has a fear of dead bodies may be asked to imagine an ambulance and then focus on relaxation. Then he may be asked to go to close to a cremation ground, and finally, like through a number of immediate steps, the person may be asked to come close to a dead body and at the same time focus on the relaxation as well. As mentioned above, apart from the approaches based on the classical conditioning, there are certain therapies also which are based on the operant conditioning called behavior modification. There are number of therapies based on operant conditioning, but all of them consist of 3 basic steps. The first objective is to identify the undesirable or maladaptive behavior. The second step involves identification of the reinforcers that maintain the maladaptive behavior. The last step involves the restructuring the environment in such a way that the maladaptive behavior is no longer reinforced. One way to eliminate the behaviors which are not desirable is to remove the stimuli that maintain them. This is based on the idea that removing the stimuli will extinguish the behavior that was earlier reinforced by it. Another method also involves the use of stimuli which have a negative impact in the form of punishment for voluntary maladaptive behavior. Operant conditioning can also be used to increase the desirable behaviors by giving the positive reinforcement when the desirable behavior is carried out. For example, if we want a child to study every day, we could reinforce study by allowing to watch a TV program of his choice every time he studies, say at best for at least 1 hour. In the recent years, a social learning approach to a psychotherapy has emerged. This model is a link between the behavior and the cognitive model of personality. The cognitive approaches views the mental disorders caused by the irrational beliefs or faulty thinking. Therapy involves cognitive restructuring or changing one's way of thinking. For example, if a person believes that a black cat crossing in front of them will cause problems, he may be made to experience it many times till he realizes that there is no link between the cat and the negative events, and thus changing their behavior. Now, moving on to the next therapy method, which is a humanistic psychotherapy. According to the humanistic view of personality, the people are fundamentally good and seek growth and work towards the better ways of living. All people have a need for self-respect and to shape their life according to free choices. Humans are special because they have free will and natural need to do all they are capable of. The need to actualize one's potential is called the basic human drive towards the self-actualization. In the humanistic view, the psychological disorders are seen as occurring because the external environment blocks us from moving in the direction of personal growth. People around us put pressure by their expectations from us. They do not accept us as we are. If everyone around us give us the unconditional positive regard, there would be hardly any gap between what we are and what we desire to be. This means that there would be little gap between the real self and the ideal self. This also leads to the greater harmony in our functioning termed as congruence. The goal of humanistic therapy is that the therapist, by creating an environment of unconditional positive regard, allows the client to get in touch with his or her true feelings and inner self. And then the client has to take responsibility and live more in accordance with the striving of the inner self. This eventually leads to the growth and greater life satisfaction. Thus, we understood about different types of psychological disorders, and we also understood about different types of psychological therapies. The medical model relies largely on the medicines and sometimes uses the electric shock and surgery to treat the psychological disorders. The psychoanalysis is psychotherapy which uncovers the unconscious conflict in the mind of a person from the earlier life experiences and also helps the person in consciously accepting them. The behavior therapy is based on the principles of classical and operant conditioning. The humanistic therapy helps a person to get in touch with their deeper needs and desires and then take the responsibility to live more in accordance with the one's inner and true nature. So, we understood about different types of psychological disorders. Psychologists have always tried to understand the causes of abnormal behavior and the best way to treat it. There are 4 major models which deals with the psychological disorders and their treatments. And we have just discussed these 4 models, which are the medical model, psychodynamic model, behavioral model and the humanistic model. The term psychotherapy is used to describe the process where a trained psychologist helps a disturbed person to behave normally. The psychologist generally uses one of the approaches mentioned above. We have read about different types of behavioral models and also have viewed and learned about the maladaptive behaviors. We discussed about different models and therapy sessions through which a person facing the psychological disorder could be treated. Now, we have completed this particular chapter number 20 and I hope this have been useful for you. Once you would reread this chapter orally by yourself, you would feel that many of the things you have understood very easily. Thank you.